The Faculty of Medicine in Romania is internationally recognized and very appealing for the foreign students. They are primarily attracted by the quality and volume of information because in Romania we emphasize both on theory and on practice, but also by the low costs, both of the university and of the lifestyle. Foreign students can choose the English module and will study in the same location as those from the Romanian module, thus having a vast multicultural experience. In Romania, after the entrance exam based on the score, students can benefit from free education, and during the faculty, they can have a merit scholarship. The admission of the international candidates starts by evaluating the files for the recognition of high school studies, and for this evaluation, the university charges a non-refundable file processing fee. Candidates admitted through the assessment of personal files can only access paid places. The annual tuition fee applicable to newly enrolled candidates in the academic year is in the amount of €8,000. The medical school is studied for 6 years. Every year, there is a certain number of credits that must be passed in order to pass to the next year. After completing the 6 years of medicine, follows residency. The Ministry of Health of Romania organizes a competition for admission for residency in the field of medicine every year in November. The admission consists of a grid exam with 400 questions, valid for both foreign students and Romanian citizens. There is a certain number of places for each specific specialization. Places are chosen in descending order from the candidate who obtained the highest score in the residency admission exam to the candidate with the lowest score within the remaining seats. The candidates opt for the specific specialization in the desired hospital and city depending on the score obtained. After the chosen specialization, there are 4, 5, or 6 years of residency paid by the employing hospital. The Ministry of Health allocates thousands of residency places every year, but very few positions as a specialist doctor after residency. So, after the residency period, if the specialist doctor does not have any positions as a doctor in the hospital, they must find a job by themselves, privately, or in other hospitals in other cities. Most of the chosen specializations are recognized in Europe and other countries, with few exceptions. Mostly, the subspecializations of pediatric fields, such as pediatric cardiology, pediatric nephrology, as well as endocrinology, diabetology, are not recognized. How one normal day as a medical doctor looks like in Romania. The field I chose is physical medicine and rehabilitation, abbreviated as medical rehabilitation. The residency program is 5 years. In the first year, there is the adult medical rehabilitation internship, and the next 2 years are internships in different specialties such as neurology, orthopedics, rheumatology, cardiology, pneumology, sports medicine, each internship being 2 to 5 months long. In the fourth year of residency, internships such as musculoskeletal ultrasound and electromyography are carried out. Finally, in the last year of residency, there are 5 months of specific rehabilitation for children, and the rest of the months are spent on basic training regarding rehabilitation of adults. The schedule of a rehabilitation doctor is 7 hours a day, 5 days a week, more precisely from Monday to Friday. We start work at 8 a.m. and we end it at 3 p.m. There are no on-call shifts in this specialization, being predominantly focused on chronic patients who do not come to the emergency room. The salary bands as a residency doctor range from 50,000 RON to 80,000 RON per year after taxes. It depends on the year of seniority and the increase in demand of the hospital. In the hospital I'm actually working, the regular consultation of a patient consists of an objective examination based largely on the locomotor and neurological apparatus. Thus, the rehabilitation doctor seeks to observe in a patient the differences in posture, vicious positions, walking quality, muscle strength, joint balance, any kind of musculoskeletal disability. Electrotherapy is part of physiotherapy, is a helpful method in the rehabilitation of patients with pain or with increased or decreased muscle tone, which uses forms of electric current for medical purposes as a method of treatment in doses and with carefully determined intensities. The procedure itself does not create discomfort. It is felt as a slightly pleasant vibration in the applied area. There are certain parameters that must be respected and that are prescribed strictly and only by the doctor. During the electrotherapy session, the patient is exposed to controlled electric current that can have different waveforms and frequencies depending on the condition being treated and the therapeutic goals. The electric current penetrates the affected tissues, stimulating the nerves and muscle fiber, which leads to pain reduction, amelioration of inflammation, stimulation of blood circulation, muscle relaxation, and nerve recovery. For example, here we have a device that shows rectangular currents, the type of medium-frequency currents that reduce muscle spasticity with a muscle relaxant, analgesic, and vasodilator effect. In Romania, the National Health Insurance Fund provides 10 days of treatment for an adult once every 6 months. I can say that it is highly rewarding to restore individuals' health after any incident or to manage living life with a disability. Having said that, being a doctor in Romania is a long road, but sometimes, depending on the chosen specialization, it can give you professional satisfaction and the joy of being able to see a patient progressing nicely.